To assess lumbar PAs, we would use a towel or sheet to properly drape the patient if needed. Then we're going to locate the iliac crest and move centrally parallel to that with our thumbs. We will probably land in a little gapping, which is the intervertebral space between L4 and L5. The bony prominence inferior to that would be the spinous process of L5. Placing our hypothenar eminence there and our second hand and applying a gentle posterior to anterior pressure. Moving superior to that would be L4 and applying that same pressure. And again, up one space onto the next bony ridge to L3, applying that same posterior to anterior pressure. This assesses regional interdependence with mobility of the spinal segments. So looking for hypo or hypermobility in the segments next to the main segment in concern. But it also assesses for pain or symptom reproduction. While the patient is still prone, we are going to do the prone knee bend neurodynamic test, which helps to see the level of nerve involvement. So passively flex the knee and assess if there's any pain provocation. Then we are also going to add hip extension. And again, assess for pain or symptom provocation. I am now going to have my patient sit on the side of the bed. For another neurodynamic test, we're going to perform the slump test. So I'm going to have the patient hold his hands behind his back and slump your posture. Go ahead and fold your neck down forward. We'll assess for reproduction of pain or symptoms here. And if not, then we're going to have the patient extend the involved side. And that does reproduce pain or symptoms, so go ahead and relax. That would be a positive test, indicating a positive neurodynamic test, further indicating nerve involvement. Go ahead and relax your posture. I am going to have my patient stand up for me now. And we are going to be doing movement, or repeated movement, to see whether the pain centralizes or moves further down the leg again, radiates down the leg. So first we're going to assess extension. Place your hands on your hips. Without pushing your hips forward or bending the knees, gently extend that spine. And we're going to do this repeatedly until the pain either centralizes or radiates down. Or we can do up to 10 reps. And again, this can also be used to assess pain reproduction and again, distinguish intensity of pain or diminishing of pain. Now for flexion, I'm going to have you place your hands in front of your thighs, and you're just going to flex down at the hips and then back up gently. And we'll do this repeatedly, assessing the same thing, whether the pain diminishes and centralizes back into the low back, or if it is more peripheral and radiates down the leg again. And go ahead and relax.